Hi, everyone. Welcome to Diabetes Primetime. We're talking about diabetes and kidney disease with diabetes expert Dr. Eugene Wright and patient advocate Dr. Patrick G. Before we get started, tell me in the comments where you're watching from and let us know if it's your first time joining us. Diabetes Primetime is brought to you by Reliant Community, an amazing program available exclusively for Walmart customers with a Reliant Premier meter. Get free diabetes tips, recipes, and support sent right to your phone. Just click the link in the comments to learn more. Dr. Wright, Dr. G, thank you both so much for being here with us.
Thank you for having me.
It's great to be here.
Dr. Wright, I'd like to start out by having you talk about why kidney health is such an important topic for people with diabetes to know about.
Kidney health is very important. More than 1 in 7 U.S. adults, or about 35.5 million people, or 14% of the U.S. adult population, are estimated to have chronic kidney disease. But only 1 in 10 of those are aware. So that means 9 in 10 are unaware that they have chronic kidney disease. Now, about 4 in 10 adults with severe kidney disease, this is severe, getting ready to go on dialysis or transplant, are not even aware. So it's very important that we understand how important chronic kidney disease is in type 2 diabetes, because type 2 diabetes is one of the leading causes of chronic kidney disease.
So, when we talk about kidney disease, what do we mean? Like, what's happening in a person's body?
We talk about diabetic nephropathy, and it's a term that we use that really describes chronic kidney disease associated with diabetes. Chronic kidney disease is a condition in which the kidneys are damaged or injured, and they don't filter the blood as well, and they may lead to waste products in the blood and increase in fluid. As a result of this, these problems can lead to other health problems such as heart disease or stroke.
So, who's at risk for kidney disease? Who should really be paying attention to this?
There are 5 main or major risk factors for chronic kidney disease. If you or someone in your family has diabetes, you may be at risk. If you or someone in your family has hypertension, you also may be at risk. If you or someone in your family has heart disease, you may also be at risk. If you or someone in your family has hypertension, diabetes, and obesity, you really are at risk. So, and if someone in your family has had a history of kidney failure or dialysis or transplant, you are also at risk. Most recently, the World Health Organization, in a brief, has suggested and actually that smoking cigarettes is associated with a 40% increased risk in developing type 2 diabetes and kidney disease.
We also know that minoritized populations are at higher risk for kidney disease. Tell us why that is.
Well, if you are Black or African American, Hispanic or Latino, Asian American, Pacific Islander, American Indian, Alaskan Native, or Hawaiian or other Pacific Islander in your heritage, you may be at increased risk for kidney disease. Now, Black or African Americans are more than 3 times as likely, and Latinos or Hispanics are 1.3 times more likely than whites to have kidney failure, and that's a problem. Minoritized and marginalized populations have a much higher rate of blood pressure, diabetes, obesity, heart disease, cigarette smoking, all which increase their risk for kidney disease. Another important factor is access to healthcare. It's been said that your zip code may be a better determinant of your healthcare outcomes than your genetic code. And what they mean by that, if you live in a rural community and you don't have access to healthcare, it's hard to get screened, it's hard to get medications, or it's hard to get to see the dietitian. Or if you live in an underserved community where you don't have regular access or you don't visit healthcare professionals regularly to get checked, you may be at increased risk for developing all of these complications.
So, Dr. G, when you were first diagnosed with type 2 diabetes, what were you told about kidney disease or your risk for kidney disease?
Well, in 2003, while working for the Virginia Department of Corrections, I was really feeling sluggish. So I went to the sick bay And the nurse, I told the nurse what was going on with me. And the nurse asked me, had I ever had my glucose levels checked? And I really didn't know what she was talking about. So she did a finger prick and she asked for my car keys. And I asked her, why did she need my car keys? Because she told me that my glucose level was 748. And if I attempted to get in my car and drive, she was going to call Virginia State Police to have me arrested for driving under the influence because my glucose level was so high. So I had to get another officer to take me to the nearest emergency room, where after they checked my glucose level again and my A1C, which was 11.7, the emergency room doctor told me that I was diagnosed with type 2 diabetes and recommended me to see an endocrinologist. So for 10 years, from 2003 to 2013, um, my endocrinologist, all she did was to put me on 2 forms of insulin and a pill to be able to help me with my diabetes. And all she told me to do was to lose weight. It wasn't until April of 2013, just going through a quarterly um, doctor's appointment with her. And after the appointment, I'm actually walking out to my car. She comes running behind me and she says, "Hey, Patrick, stop. I have to tell you that right now you are at stage 3B of end stage renal disease and you have 30 to 35% kidney function." Now, mind you, I did not know anything of what she was talking about because it was foreign, because she never once told me that diabetes was number one leading cause of kidney disease. So she recommended she recommended that I go to a nephrologist. And when I went to the nephrologist was like, "Well, Patrick, eventually you're going to go on dialysis, but what we can do to cut down on the severity or the quickness of how fast you're going to go on dialysis, we need for you to abstain from dairy products, chocolate, and nuts." So over the course of probably about the next 8 months, I gained 150 pounds of fluid. It was hard for me to lay in the bed and sleep comfortably. I had to sleep sitting up in a chair because I felt like I was choking or hyperventilating. Basically, it was almost like I just crashed into dialysis because of late diagnosis with kidney disease.
I think Patrick makes an excellent point because early on, typically there are no symptoms. And that's the problem. In the later stages of kidney disease, symptoms such as frequent urination, more or less often than usual, foamy urine, itchy or dry skin, feeling tired, nausea, loss of appetite, weight loss or weight gain, all are very nonspecific symptoms. So it's worth noting that you don't want to be the person that your first symptom is your last. Patrick was lucky. He was diagnosed and was able to take an action.
I have so many more questions for both of you, but we are going to pause here and do our trivia question. Everyone who answers this question will get a collection of delicious, healthy recipes for soups and stews. All you have to do is answer our trivia question, which is, true or false, there are more than 500 muscles in the human body. Is that true or false? Are there more than 500 muscles in the human body? Put your best guess in the comments, and regardless of whether you're right or not, you will get those recipes delivered to your Facebook Messenger inbox. And folks, if you can think of any friends or family members who might find this show helpful, please tag them in the comments so they can tune in too. Dr. Wright, what information can tell a person how well their kidneys are working, and why is that so important to track?
The eGFR, which stands for Estimated Glomerular Filtration Rate, is a measure of kidney function, and that is rated on a scale typically between 0 and 100, where 90 to 100 is considered to be normal. Less than 90 indicates potential problems. Less than 90 may represent mild decrease in kidney function, all the way down to less than 15, which typically represents kidney failure. Now, on the other hand, the urine albumin creatinine ratio, or UACR, is an indicator of the ongoing kidney injury or damage. And this can be very important in assessing whether or not there's injury and or loss of function going on in the kidney.
Why is this something we want to be tracking? Can detecting any kidney problems early help us prevent complications down the road?
A great way to think about this is the analogy that I like to use, that where there's smoke, there's fire. If you see smoke coming out of your house, you don't wait to see the flames to determine that the house is going to burn down. You go and look right away. So think about the urine albumin creatinine ratio, UACR, as being that smoke signal. It's an indicator of early kidney injury and or damage that can lead to loss of function.
So, Dr. G, you left us November 2013. Tell us what your experience with kidney disease has been like since that time.
Well, stayed on peritoneal dialysis and also did in-center hemodialysis a couple of times due to various surgeries where I couldn't do peritoneal dialysis. But on April the 21st, 2017, I received my kidney transplant. But when I woke up from my kidney transplant, I was told that I was dealing with delayed graft function and or what's known as a sleepy kidney. And I had to end up doing that. I had to end up doing hemodialysis 24 hours a day, every other day. My kidney did not wake up until the 47th day. 2.5 years prior to me getting a transplant, I wasn't able to urinate. So that one drop of urine that came out literally changed my entire life. It really made me think about what we take for granted. Imagine trying, or when you try to train a child in how to potty train, and you continue to to encourage the child to make sure that they hit the water. Now imagine somebody in their 50s that has to relive just being able to perform a human bodily function. So for me, my advocacy became my ministry. And in being able to go into the community and help those that are currently dealing with diabetes as well as chronic kidney disease, I'm just able to be out and to be out in the community to share my story with everyone. And also, I consider myself a hope dealer. So I'm a very optimistic person. And a lot of times when you're dealing with diabetes and chronic kidney disease together, um, you could fall into depression, anxiety, and worry. So I consider myself an individual that can be there to make sure that certain communities are able to get health literacy, um, make sure that patients know how to engage with their physicians properly, and just be a motivator and an encourager to those that are actually going through this, because I really don't want anybody to experience any of the heartaches and pains that I went through. But since I received my transplant and my transplant has now kicked in and fully functional, I am doing wonderful.
Oh, I'm so glad to hear that. And after hearing kind of what you've been through with surgeries, time in the hospital, I understand why you are so passionate about advocacy work. And we'll talk more about that in a moment. But Dr. Wright, I want to turn to you. Is there any aspect of Dr. G's experience that you see with your patients? Is this a common occurrence?
Sadly enough, it is. But what I want to say about Patrick's experience, as much as he has been blessed, he is a blessing to all of those other patients who have not yet experienced half of what he has. Learning from him, and I encourage my patients to think about acting early, detecting early, and when you can make a difference and not waiting too late. So I think Patrick's story is not uncommon. We find many people that the first time that they find out about a disease like end stage kidney disease or kidney failure is at the point that they are, as you say, Patrick, crashing into dialysis. It doesn't have to be that way. And I think that Patrick's advocacy, along with the kinds of programs, Ainsley, that you are doing, can help people realize that it doesn't have to be that way.
So, Patrick, in your advocacy work, what is your main message? What do you feel is most important for people with type 2 to know about kidney disease and prevention?
Well, one of the things that I love to share about when it comes to diabetes and kidney disease is that you're not defined by your disease. There is life and you need to fight for yourself. But the biggest thing is to be able to get information. With me growing up in an inner city, low income community, I didn't know anything about diabetes. Now, we always heard the slang term of sugar, but I never thought or related sugar to be diabetes growing up. So, what I like to do is to be able to go to these underserved communities and to be able to meet people where they are. Not only do I offer health literacy information, but I also take with them nutritional information that I may get from a diabetologist or a nutritionalist so that folks can certainly know how to manage their nutritional health by eating properly. Um, Also, talking to them about the new medications and new innovations that are currently out to be able to help them to manage their kidney disease as well as their diabetes. And again, to always encourage folks to be a very important part of their healthcare plan, to be fully engaged not only with their primary care physicians or even the folks in their transplant centers, but to also try to find a dietitian or nutritionalist, also stay engaged with your pharmacist, even to go and seek counseling because of side effects from diabetes. Again, as I alluded to, anxiety, depression, sadness, worry can really take a toll on you. So I really encourage people to um, really take charge in managing their care when it comes to diabetes and chronic kidney disease.
Dr. Wright, if someone with diabetes is listening to Dr. G and recognizing how important it is to take this seriously, what can they do now to prevent future issues with their kidneys?
First, you want to see if you are at risk. There's a very simple 1-minute online test at minuteforyourkidneys.org. Take that test and determine if you are at risk. Not all people will get kidney disease, and not everyone that has diabetes, not everyone that has high blood pressure, not everyone who's older age or family history will get kidney failure. But if you have a risk factor, you need to get tested. We've talked about the two tests, the EGFR, which is a blood test, and the UACR, which is a urine test. These two simple tests can start your journey on detecting chronic kidney disease early and when it's the most treatable. These are very simple tests that you and your healthcare provider can work on and get together and track and follow over time. A couple of other simple things that you can do. Live a healthy lifestyle. Be sure to eat well and exercise as much as you can. If you smoke, stop. If you don't smoke, don't start. It can also help a number of other chronic diseases such as hypertension and heart disease. So it's just a good idea.
So let's say that someone has been fortunate to get diagnosed early with kidney disease. What can they do to keep it from progressing further?
An important thing to do is to meet with your healthcare professional. If you have diabetes, take your diabetes medication. If you have high blood pressure, take your high blood pressure medication. There are several other medications that we have that can slow the progression of chronic kidney disease. It doesn't have to end up crashing into dialysis. We can do a lot. While we can't reverse kidney disease, we can prevent or significantly delay the progression of kidney disease.
Dr. G, tell us about the treatment you're currently receiving. What's your day-to-day experience like now?
I've been on a GLP-1 ever since 2020. And last year, October 2023, I was put on a SGLT2 inhibitor. So not only does that also protect my uh, kidneys, but it also helps with my diabetes management as well as help with heart disease because I do have a family history of heart disease. I also enrolled in a weight loss program, which is currently at the hospital where I had my transplant done at. And in there, I have a diabetologist now and a nutritionalist that I often talk to at least once a month. And what they've done, they put me on a very regimented kidney friendly and heart friendly and diabetes friendly diet. So I exercise. I've lost over 100 pounds. My A1C, as I stated before, was 11.7. Now, on an average, it's anywhere from a 5.3 to a 6.0. So, in making these lifestyle changes, it has really not only helped me to feel better, but to feel better about myself and to be able to help other people to um, meet the expectations that they have set for themselves in living a better life with managing chronic kidney disease and diabetes.
Wow, that's such an inspiring story. So, on an ongoing basis, I feel like this show is really all about tracking our numbers. What are the numbers that you pay attention to when you go to the doctor's office? I'm sure you're looking at your kidney numbers, but what are the other diabetes related numbers that you're looking at also?
So every time I go to the doctor's office, they do like a eco skeleton printout of me when I do my weight. So I want to make sure that my BMI, my body mass index numbers are really looking good. They show me my muscle fat ratio, trying to make sure that they are normal. Of course, every day I check my glucose levels. Um, every 3 months, I check my A1C. I'm also checking my high blood pressure, want to make sure that my blood pressure is normal or is stable. Of course, checking my EGFR um, to make sure that my creatinine level is really good, that my kidney health is doing well. So the numbers count in managing kidney disease and diabetes.
Dr. Wright, anything to add?
Yeah, I was going to say Patrick makes an excellent point, and it's almost like a report card that you have, and you want to keep score because these scores matter because there's your health. And another thing is you don't have to wait until kidney failure to track these numbers. These are things that you can start early on before you have significant or severe kidney disease. There's another saying that I have with my patients is that you don't have to be sick to get better. So you want to think about it this way. Don't wait until you're at a bad point where you say, I need to start tracking these things and doing better. Start earlier. You can slow these progressions down to these end-stage kidney disease and all of the complications that come with it.
Folks, in case you're just joining us, we're having a wonderful conversation with diabetes expert Dr. Eugene Wright and patient advocate Dr. Patrick G, talking about diabetes and kidney disease. We're giving away a collection of delicious, healthy recipes for soups and stews if you answer our trivia question, which is true or false, there are more than 500 muscles in the human body. Is that true or false? Are there more than 500 muscles in the human body? Put your best guess in the comments, and you will get those recipes delivered to your Facebook Messenger inbox. Dr. Wright, I have a question that we hear so often from people. Does everyone with kidney disease end up on dialysis?
Not all people, not all patients with kidney disease develop kidney failure. First point. We have medications now that can slow this and so essentially stop that progression to the point of kidney failure or dialysis or transplant. Some patients get a transplant before severe kidney failure. And some patients, unfortunately, develop heart conditions that could lead to death before the kidneys actually fail. One thing that's not often well appreciated, that kidney disease, particularly chronic kidney disease, as it progresses to stages 4 and 5, is associated with a high degree of heart conditions that may lead to death, heart failure, stroke, and heart attack. So not all patients with kidney disease end up with dialysis or transplant.
And if a person has chronic kidney disease, is there a medication that kind of like reverse the damage?
Unfortunately, we cannot reverse kidney disease. We haven't figured that out yet. However, we can significantly slow the progression of loss of kidney function to the point that people may live a nice, long, and healthy life without having kidney failure or transplant or dialysis or any of the other conditions that may be associated with chronic kidney disease. So it's important, again, I can't stress how important it is to diagnose this early and treat it aggressively to be sure that you are one of those people that does not have to end up on dialysis or with a heart attack or stroke.
So let's talk about the good news, which is that there are several diabetes medications that can be helpful for addressing kidney function, right?
Absolutely. There's a whole class, there are several classes of medication. Patrick has mentioned a couple of them that he's on, and they have been shown in studies to really significantly slow this progression of kidney disease. In fact, some of them are even noted to be kidney protective agents. So it's important to talk with your physician and your healthcare professional about what might be the best therapy for you. For those patients with diabetes, Patrick mentioned the GLP-1 class of medications. There are newer classes that are so-called dual agonists, GLP-1 and GIP drugs. There's also the SGLT2 inhibitors and a whole other range of nonsteroidal mineralocorticoid receptor. It sounds a lot and very complicated, but your clinician will be familiar with all of these therapies and will be able to choose the best therapy for you.
Dr. G, tell us about the advocacy work you are doing now to help spread the word about the connection between kidney disease and diabetes. And if someone watching is interested in how they can get involved, tell us how they might do that too.
So again, through the American Society of Nephrology, I'm the only patient that sits on the Diabetic Kidney Disease Collaborative Task Force. And one of the things that we've done is that we've come up with a patient education module that was released January of this year. So this module um, is for patients and care partners and caregivers to be able to go on, and it will take you through various steps of the journey with diabetes and chronic kidney disease. And you get to hear the perspectives not only from patients, but from clinicians, researchers, as well as pharmaceuticals or pharmacists, excuse me, where they give their particular perspectives on trying to help patients to be able to manage diabetes as well as chronic kidney disease. Also, also work with the American Heart Association, and of course, they just released um, a notification last year on cardiovascular kidney metabolic syndrome. And this particular syndrome is where you have diabetes, kidney disease, hypertension, and heart disease and obesity. And because there is no cure um, for any one of these diseases, their interconnectivity tends um, to cause more harm when you have two or more of these comorbid conditions. So, being an advocate in this area and just getting the words out, not only um, through the communities, but also internationally, just trying to encourage people to really take better care of themselves.
Patrick makes a good point. There are a couple of other organizations the National Kidney Foundation, or NKF, has an excellent website in English and in Spanish that's a great resource for specific questions about chronic kidney disease. Also, the American Diabetes Association at diabetes.org has a tremendous amount of information in English and in Spanish about diabetes, heart disease, and kidney disease, and are great resources that you can go to and get more information.
We will put a link in the comments to both the educational module that Patrick has created, as well as the risk test that Dr. Wright mentioned earlier, as well as all the websites that we've been talking about in this show. So look for those in the comments. Last question for both of you. What is the number one thing people with type 2 should know about kidney disease? Dr. Wright, we'll start with you.
Get tested, know your risk, and remember that you don't have to be sick to get better.
Dr. G?
When you have learned that you have symptoms of either diabetes or chronic kidney disease, please don't put it off. Please go and get checked immediately. Do not fall into a situation like I did. Make sure that you are proactive instead of reactive when it comes to your healthcare.
Dr. Wright, Dr. G, thank you both so much for joining us tonight. This has been such an inspiring conversation.
Thank you for having us.
Thank you. It's always a pleasure to talk with you, Ainsley. And Patrick, keep it going.
Yes, sir. And you do the same.
And a big thank you to everyone watching at home. We so appreciate you being here and chatting with us in the comments. Before we go, here's the answer to our trivia question. True or false, there are more than 500 muscles in the human body? The answer is true. If you didn't get to answer the trivia question, but you'd still like those delicious soup recipes, just leave a comment for us and tell us what you thought of the show. We will be back to you with a new episode in a few weeks. Until then, please stay safe and take good care. Good night.